Well, welcome to Focus Today. Steve Johnson here with you, and we have a special guest who's been with us a few times, and it's great to have Dr. Joel Klein back again.
Great, thanks,
Good
Steve.
to have you here from Ventana Wellness.
Always
we were
good.
just talking about this. You've been here 7 months now.
Seven
in the
and a half.
yeah, and I think we've had you on at least that many times, I would say.
Not quite. Yeah,
Not quite?
I think 4.
We're working on it.
We're
all right.
working on it, right?
Well, and you've got a special seminar coming up, and I want to talk a little bit about that because it deals with a theme of what we're talking about today, and this has to do with thyroid problems for men and women. Now, look, I'm a layperson. This might have just been an expectation, but we were talking about it during the morning show. We normally associate thyroid problems with women.
Right.
And not so much thyroid problems with men. But you're saying this is a problem for both sexes.
It's
really.
both, yeah. But 90% of thyroid problems are in women. That's true. But there are 10% in men. And
10%.
Yes, and it can be missed there too because it will masquerade as all kinds of other problems commonly.
All right. Well, let's talk a little bit about that because let's mention the Smullen event for
Right.
people who are already saying, okay, you know what, you've grabbed me already. Thyroid problems, I need to know more about it. Tell us the details of. Is it a seminar you're having?
Yes, it's a free, open to the public seminar, Smullen Center, on next Tuesday, the 5th at 7 o'clock. Both Nisha and I will be talking. Nisha will be talking more general hormones, as she does, because she's the big cheese in that department as well. And I'll be specifically addressing thyroid issues.
All right, excellent. And you know what, if you've got some questions about that today as you hear our discussion, feel free to call us in, 541-776-5368. That's the number you can call. Let's talk about the basic problems. You say 90% thyroid problems in women, 10% in men, roughly.
Right.
Describe what the problem is that we see, and at what age do thyroid problems start?
Any ages. Actually, depending. The thyroid is the gland that basically controls our metabolism. Some people have equated it to the accelerator on the gas pedal, controlling our metabolic rate. Every system in the body responds to thyroid hormone in terms of metabolism. And what's become very prevalent, it used to be back in maybe 100 years ago, it was referred to as dropsy.
Yeah, I remember hearing that
They
term.
didn't know what it was. It was the more florid form of hypothyroidism, but it's basically what's the most common thing is when the gland is not functioning properly, it's not putting out enough hormone. And it can show up as all kinds of different problems in the body. I tell people, if you ask me, could XYZ symptom be related to my thyroid? I'll say, unless it's something that's indicative of another problem like bleeding from somewhere, the answer can very commonly be yes, because it will show up as different things in different people. The most common symptoms are fatigue, either weight gain or inability to lose weight despite diet and exercise, feeling cold when you shouldn't be feeling cold or wouldn't think you would normally feel cold, and there are a number of others. But the fatigue and the weight are usually some of the bigger ones.
All right, now I would say that you said there's really no age. In my mind, I'm thinking this is older people who are maybe going, postmenopausal and that kind of thing. But that's
not at all.
Not
at all. I actually, on the other side, there are smaller who have overactive thyroid. And
right.
I had a 14-year-old in my practice with that. We don't usually see the underactive in the teens, although we can. It's not, as common, but we've seen teenagers with it, and then anywhere through. In fact, and yes, even into people that I'm recently diagnosing who are, yes, in their 70s and even 80s.
So if let's talk about the hyperactive, since that's kind of the less percentage, I suppose, right? What are some of the symptoms of that? Isn't that where growth takes effect too much?
Ooh, well, no, actually not with that. With hyperthyroidism, it's as if the accelerator pedal in your car has been floored with the car in neutral. So the engine's revving at 7,000 RPMs, and it's palpitations, racing heart, anxiety, sweating, weight loss. So everything is grossly over-accelerated.
I suppose at that point, especially with anxiety and all that, people are just wondering what's going on. They're probably not identifying it.
Absolutely think they can be going crazy. In fact, this is why even back in the 70s, what they started realizing, anybody admitted to a psychiatric care unit had thyroid testing automatically, because it could even show show up as schizophrenia or mania in manic
Really?
depressive illness. The anxiety part is a big proponent. In fact, the endocrinologist that I trained with as a resident would tell all of his hyperthyroid patients, do not make any major decisions in your life until we get this under control, because it will look like everything is urgent and has to be done now. People will quit their jobs, sell the house, and all it's because of what the thyroid's literally doing to their brain.
That is amazing. I think that's a fascinating correlation that way, because only a medical person could probably really identify that, unless somebody's going on the internet and finding all this stuff.
Right. Well, nowadays, people are becoming pretty savvy. Although the problem is, you can diagnose off the internet, and the body only has so many ways of exhibiting symptoms. So there are a lot of different conditions that could present with somewhat of the same symptoms, and you can overdiagnose. Certainly by the internet, we see that all the time.
Well, let me just, since we're talking about the hyperthyroid, like this young. I guess he going through puberty and all the rest. Although that doesn't, did that have something to do with it at all?
Not necessarily, but in his case, he wasn't. After we treated his hyperthyroidism, I think he grew a foot.
Oh, wow.
Over the next year, because it was retarding his growth because everything else was being accelerated.
And he was able to make up for it then? Mm-hmm. Oh, that's pretty amazing.
When people are young, they still have wonderful recuperative powers.
So what were you able to do? Do you put them on is it a metabolism problem that they have to diagnose, or how do you resolve that?
Both the hyper and hypothyroidism frequently can be related to autoimmune issues. And those of us who do more integrative or functional medicine have learned that there can be a significant dietary component to autoimmune conditions, with gluten being a big problem, sometimes dairy, soy, corn. But in his case, with hyperthyroidism is more dangerous and potentially life-changing. So we want to get them on treatment quickly, and there are medications that are used to suppress the thyroid. But what I would try to do over time, and I was actually successfully able to do with him, is put him on an aggressive autoimmune program, so that over time he was took months, able to get off the medicine. That
was going to be my next question. So he doesn't have to stay on it his life?
He doesn't. Commonly people do, or there comes a point where the disease is not controlled in people, and this is where they will use, more commonly these days, radioactive iodine. In some cases, surgery. They try to avoid surgery because there are all kinds of vital structures in the neck that even the doctors don't want to have to operate around if they don't have to. But the more common definitive treatments are radioactive iodine and surgery, more with the iodine.
And that's really an old chemical to use, right? I mean, iodine is pretty simple. It's been around for a long time. It's not like a new thing, is it, to use in treating?
No, but I guess using the radioactive iodine.
Oh, radioactive,
Oh, yeah, see, because in hyperthyroidism, we're actually trying to kill the gland if we have no other choice. So you're inducing a very local form of radiation poisoning right to the thyroid gland to eventually kill it.
Wow, and it can be that specific.
Oh, yeah, because the iodine, radioactive iodine, doesn't emit radiation very far off the body in the doses that are using. Although it's interesting, when they treat thyroid cancer, they give very large doses, and people are literally radioactive for a couple of days, and they put them in hospitals and wall them off in the room because the people don't come near them. But with the that's with cancer.
Yeah.
But with with hyperthyroidism, it's a low enough dose. People are not endangering anybody around them, and the radiation stays pretty sequestered into the thyroid gland.
Okay, we're going to be mentioning more about Dr. Klein. He's going to be at the Smullen Center March 5th, 7 p.m. talking about this very issue. You might have some questions right now, and we'd like to take them. Questions or comments, maybe you've had some experience in some way. Let us know. 541-776-5368. That's how you can call us, 541-776-5368. Is there a misunderstanding by some physicians, and I guess I'm asking you to grade your profession on this, about what the thyroid, how it should be treated, perhaps, or maybe even diagnosis of somebody?
There's a lot of controversy. Really, there's many people who've looked at this and feel that some assumptions were made 40 years ago, which are not really accurate. Okay, treatment.
We've learned a lot then about this.
Again, doctors who do what I do say one thing, the conventional community will say, no, this is not accurate. There are a lot of us, we feel, my experience is maybe about 20 to even 25% of people with underactive hypothyroidism don't properly respond to the regular medicine that has been used now since the 60s. The synthetic thyroid hormone, but it's bioidentical. It's the same exact hormone that was under the brand name Synthroid, or known as levothyroxine. But there seems to be a significant percentage of people who don't respond to that. Their blood tests are normal, but they still don't feel well. And alternative doctors have known for many decades using the old Armour pig thyroid, which is supposedly not as reliable, and you can't trust it according to the standard conventional wisdom. Works much better in people. And then there are either all kinds of other combinations that I find I have to use, particularly in people who have other medical problems. If they do have other autoimmune diseases, they have chronic issues, the chronic fatigue patients, people with gastrointestinal problems also don't seem to convert the hormone that's in the regular prescription into the active form of the hormone well, and they do better when you give other things like the Armour.
But it's really a fine-tuned kind of procedure. It's not one size fits all, is it?
Well, that's the debate.
Oh.
In terms of the way it is treated now by regular physicians, if your numbers are normal, then you should be fine no matter how you feel.
And you're saying it should be, you're of the camp that it is more fine-tuned then?
Oh, absolutely. It's very individualized. I have all kinds of people whose numbers are fine and they feel poorly, and I tweak their regimen and they feel much better.
Oh, that's good. This is a fascinating discussion about thyroids, because I think we are debunking some of the stuff, the common knowledge of what you may have assumed or didn't assume. I had assumed that mostly it was totally women who are involved with thyroid problems, but Dr. Joel Klein is here to say, no, there's about a 10% population, you said, who men are certainly involved in it.
Right.
It can be hyper or hypothyroid.
Yes, the
active.
hypo is much more common. The hyper is much less common, and it is more of an autoimmune issue almost exclusively. And again, autoimmune issues, interestingly, are also about 90% women.
And when you say hypo, you mean a thyroid that isn't acting as it should. It's less than
low,
it should
yes.
be doing.
Yeah,
Low,
it's
okay.
confusing. Hypo means low, hyper means yes. It's easier to remember hyper.
Well, he's going to be speaking at the Smullen Center. That's at the Rogue Valley Medical Center. It's just outside the building. It's kind of near the parking lot.
Yes,
there.
it's right off the Barnett Street entrance.
And
there.
it'll be March 5th, 7 p.m., and you're talking about
Barnett
the
Avenue.
thyroids for men and women?
Right.
That we're talking about, right? Okay, and we're taking your calls, and Jan, I want to thank you. Thanks very much, Jan, for holding through that. That was a long break. But you've got a question about genetically modified food and thyroid. Is that correct?
Yes. Tomorrow night there's going to be a talk, a really good talk at the Unitarian Fellowship on 4th Street in Ashland, and it's going to be about genetically modified food,
right.
USDA hearings, and the RBGH that they took out of dairy products, and
right.
the Proposition 37, why it didn't work. And I'm wondering, because there's been studies that when doctors take people off of genetically modified foods, they get well.
Well,
and I'm
it's hard
wondering
to...
if you have seen any of that, or if you're telling your patients to get them off of GMO foods and stuff.
Indirectly, not GMOs specifically, but the issue is the most common definable cause of an underactive thyroid is autoimmune, or what was commonly known as Hashimoto's thyroiditis, named after the Japanese doctor who first described it. And there has been a clear link of Hashimoto's thyroiditis and gluten, which was even published in a gastroenterology journal in 2007. And it very well may be, these are several leaps of logic, but that the more genetically modified strains of wheat that are being used, or the monocultures of wheat that are being used, have a type of gluten in them that's even more prone to causing the autoimmune disease. So anybody who has an autoimmune disease, I'm taking them off of gluten, and quite frankly, if they can handle it, I take them off of dairy, corn, and soy, and do a whole lot of other things. So it's not just the GMOs, it's really all of it that can be a problem. But I think that the GMOs may very well be causing some of these kind of issues, so that I actually ask people to routinely avoid them. But I also always tell patients, the one order I give everybody is they're not allowed to stress out over their food. Because worrying about your food is probably worse for your system than eating the bad food itself, because of what stress hormones and worry do to the body. So, everything in balance there.
All right, John, appreciate it. Thank you very much for your call. 776-5368, the number to call, of course, area code 541. John has called that number, and you've got a question about thyroidism and another disease, what the interaction with that and Crohn's disease?
Yeah, my son recently was diagnosed with Crohn's disease. It's been kind of a battle. He's 11. He had surgery up at Dornbecker, and they removed the infected part of the ileum.
Right.
And now listen to the doctor here discussing how it's the thyroidism is an immune disorder, just like Crohn's. So my question was, is it possible that a thyroid that causes an immune disorder could be responsible for something like causing Crohn's?
It's actually deeper. It's the same immune disorders causing both the thyroid and the Crohn's at the same time. In fact, very commonly, what we'll find as we trace histories in people, that people who come in with some autoimmune disorder when they're older, let's say rheumatoid arthritis, lupus, one of these types of things, 5, 10, 15 years earlier were diagnosed with hypothyroidism. And the thyroid is not causing the Crohn's, it's the same underlying cause, which is the inflammatory response commonly to foods that causes both the thyroid and the Crohn's and other inflammation throughout the body.
Yeah, that's a good thing to hear, because right now he's on the immune suppressant drug that he gets every 2 months.
Right.
And it seems to be controlling it, so my understanding then that it'd probably be controlling thyroidism. Which we've never had I've never heard any of the doctors mention anything about thyroidism because it was diagnosed as Crohn's. So
right. Well, they can be all. That's the problem. It's very individual, and the same underlying inflammatory problems will show up as different diseases in different people because of their unique genetics. When the underlying problem is actually the same thing, and it can be anything from asthma, eczema, arthritis. Other autoimmune diseases, menstrual problems in women, all these different inflammatory problems can come from these deeper food allergies, with gluten being the main one causing it, but other ones causing it as well.
Okay, well, thank you for taking time to answer my question.
Yeah, John, thank you. Appreciate it very much. Are you suggesting then if somebody's diagnosed with Crohn's that the doctor should be looking at the thyroid specifically as well?
Not necessarily. You want to look for signs. Again, if there's an autoimmune process causing the Crohn's, it could be affecting any other tissue in the body. Potentially, thyroid is one of those.
Oh, okay.
So you don't want to just assume, I mean, if somebody's having other symptoms, you want to check the thyroid and look at that, but it's really just looking at the whole picture for if there are other symptoms. The problem is there are some things, so people with Crohn's will have an arthritis that they will associate with the Crohn's. I will propose it may very well be that arthritis is just another manifestation of the same deeper inflammatory autoimmune process. Like that's what's in the root of the tree, and all these other things are the different branches, the different body systems may respond at any time because it's in the root of the tree.
I know that you've talked before about how so much of what we have is so interrelated, and we'd like to come up with one magic bullet, to fix this problem, but there are so many things that are interrelated that it could have impacts.
Well, the magic bullet is actually what we eat, because there is a magic bullet, but it's not a drug, typically.
Oh.
What we're eating that we're reacting to that's causing these different interrelated problems. And it's diet, stress, and environmental toxins, under which I will include certain pharmaceuticals, particularly things like antibiotics, that then mess up the GI environment, in my experience, are the main underlying causes of most people's disease problems.
And when you're mentioning this, it reminds me of the recent study results we got about the Mediterranean diet, another positive indication that people live longer, and it's a pretty simple, basic diet, eating whole foods and natural foods and vegetables and all.
Real food. Actual food, as Michael Pollan says, not food products or food, whatever that came out of a food processing company's plant.
I'm sure we'll be talking to you about that topic probably all in
I
and
will
of
talk
itself.
about it ad nauseum, because that's the main issue.
All right, we're talking with Dr. Joel Klein with Ventana Wellness. He's going to be at the Rogue Valley's Smullen Center, or Rogue Valley Hospital Smullen Center on March 5th at 7 p.m. So he'll be talking about thyroids, more about what we're discussing here today. Janet has called us. Janet, you actually have been diagnosed with a problem thyroid, is that correct?
Yeah, I have a hyperthyroid.
Okay.
And I'm on the low end, so I'm not on medication.
Okay.
But I kind of diagnosed myself and then had blood work done, and it's just because speeded heart rate, losing weight, and my age, I really should be gaining weight.
Right.
No sleep. But anyway, so I'm not on anything for it. But my mom was diagnosed with MS later in life.
There you go.
And she also had the same body type, and when I look back, was very thin during this time too. I was wondering if MS is an autoimmune disease, if there's any kind of connection.
Absolutely. MS is an autoimmune problem. Some progressive people think there may be a viral trigger that's associated, but at its root, it is an autoimmune inflammatory problem. So there is some undercurrent in your family of propensity to autoimmune diseases. Again, the gluten issue can be there. Somebody like you in particular, well, let's put it this way, had the opposite effect. Nisha and I share a patient who has low-grade hypothyroidism from the Hashimoto's. But still an autoimmune thyroid problem, and we're actually using diet as well as this therapy called low-dose naltrexone. It's another long story, but it's a drug that's usually used for narcotic overdoses, and we use about a very, very tiny dose in people with autoimmune problems. They just take 1 capsule at night, and it reverses the inflammatory process, and her thyroid is getting better. And her TSH is normalizing just on that therapy. The similar could, very possibly be somebody like you. If you get it early enough in these kind of stages, we can reverse the thing and keep people managed without the disease progressing, and actually even cure it at times.
Well, that's very encouraging, Janet. Does this help you? I think it probably does.
Well, I just kind of looked back and thought, well, my mom, I remember we all thought, oh gosh, she needs to eat and stuff, but it was really just her body style. And then I come to this age and I'm kind of that same, everybody thinks, oh, you need to eat. And it's like, it doesn't matter how much I eat,
Yes.
I just can't put the weight on.
People with your body type.
And then my mom comes with MS late in life. And so I've just been concerned that I'm kind of following in the same.
Yes. There's hormonal issues, particularly adrenal, in people like you who are the thin, high metabolism types, and we find, yes, they are more prone to these inflammatory types of problems.
Okay, well, thank you so much.
You bet.
Yeah, Janet, thank you for that call. I'm just curious about the patient that you said you are treating in this, I suppose it's a rather unique way.
Somewhat, yes.
Somewhat. How soon did you see the results take place?
Within a couple months. I think I just saw her a number of months ago, and what was it? Nisha and I were talking a couple of weeks ago, and she said her TSH is normalizing within and actually she's struggling with the diet. The diet's tough for people who are used to a regular diet, and she's not doing it quite as well. And I tell people, don't stress out, do the best you can. But yet, even with that, just using this one particular therapy, her numbers are normalizing.
Now, just briefly, because you're going to talk about more of this at the Smullen Center.
Some of it, yes.
I want to mention some of the specifics on the event. How do people know if they should get tested? Just very briefly.
If you don't feel well.
Okay. Is it as simple as that?
This is the classic, I don't feel well, and they tell me all the tests are normal.
I see.
This is the classic. You're tired, your brain fog, or you can't lose weight, just all these other kind of sluggish feelings, depression.
Really?
Absolutely. Depression can be thyroid, and yet nobody can find anything wrong. It is commonly misdiagnosed as just depression, because we'll see people whose numbers are normal or close to normal, and they're told, no, it's not your thyroid. It turns out it still is. All
right. You can hear more from Dr. Joel Klein with Ventana Wellness at the Rogue Valley Medical Center. It'll be at the Smullen Center, specifically March 5th at 7 p.m. So thanks for being with us.
Great. Thanks, Steve. Always a pleasure.
Yeah.